the wonks, the healthcare wonks, are now starting to champion this story coming out of California. And we've spoken on this program at many times, some more than others, as to what to anticipate come this fall. The law calls for 50 state exchanges to be set up, whereby if you do not get employer health care coverage and you are not eligible for expanded Medicare, I put a little asterisk there because we know the Supreme Court has made that dynamic a little hinky, but let's just stay in this area of exchanges. If you do not get employer health care coverage, or if health care coverage provided by your employer constitutes more than 9.5% of your income, you are eligible for these exchanges. The idea behind these exchanges was that it would bring in healthcare insurers, put them in one central location, literally a website, where you could shop for different types of plans at different price points. The idea is that within the state, it would create competition. The insurance that was provided in these exchanges or offered in these exchanges would have had to hit a minimum federal standard and any greater state standard in terms of what this health care must provide and comport with the state's regulations. Some 26 states, I think it was, basically said, we're not doing it. We're going to allow the federal government to set up our health exchange for us. This has made implementation a little bit more difficult, but supposedly these health care exchanges will be ready by October. Some states have been aggressive in trying to make these work. Other states have been aggressive in trying to make these exchanges not work. California is one of those states that immediately upon the passage of this law set up their exchange. Now understand, if you enter into this exchange, from the very beginning you are offered certain plans that are available there. If your income falls between 400% and, I guess, 100% of poverty, or 133% of the poverty line, you are eligible for federal subsidies, depending on where your income lies, how big your family is, et cetera, et cetera. So California set up this exchange. It will have 13 insurance options. In 2009, the CBO predicted that a medium level, a so-called silver plan, as opposed to a gold plan or a bronze plan, and for those of you who follow the Olympics, you know in which order those run, gold, silver, and bronze. A silver plan, which covers 70% of a beneficiary's expected health costs. The CBO predicted that on the California Health Exchange, it would cost $5,200 annually. More recently, apparently, a report from a consulting firm predicted it would carry a $450 monthly premium. Not good with math, but that's more around the same as that annual estimation, more or less. Well, now California has announced the actual prices. It will have 13 insurance options, and apparently the exchange is working. The most affordable silver level plan, and I guess you have multiple plans within those three categories, is $276 a month. The second most affordable plan is $294 a month. This is all before subsidies. So how much you will actually pay will be a function of your income. Someone making twice the poverty line, 200% of poverty, will pay $104 a month. Spare plans are even cheaper, according to Sarah Cliff at Washington Post. A young person buying the cheapest bronze level plan will pay $172 a month, and again, that is before any subsidies. So there is at least some reason to believe that insurance prices are going to be even less in many states than had been anticipated upon the ratification of the Affordable Care Act. In Oregon, apparently what happened, one insurer came in with a monthly premium cost in the $169 range. Other insurers wanted to charge more than $400. In seeing what their competitors were charging, two insurers came back to the state's regulators and asked if they could refile at lower rates. So it seems to be working in states that have been aggressive and embraced the Affordable Care Act. Now, there are some caveats to this. Aside from the fact that there are several states, and we'll get into that, who have done everything they can to foul this up. Texas comes to mind.